Hey there, welcome back to the channel. Have you noticed that you are more congested in the springtime? Do you have more sneezing fits during certain seasons? Well, you could be having seasonal allergies. And today, we're going to talk about how to recognize it, what are the triggers, and then also how you can find some relief. So let's go ahead and dive into it. Seasonal allergies, also known as hay fever or allergic rhinitis, is an immune system reaction to otherwise harmless substances in the environment, like pollen from trees, grasses, or weeds, as well as mold. When people with seasonal allergies encounter these triggers, their body will release histamine and other chemicals that cause inflammation of the mucous membranes. This reaction leads to symptoms like sneezing, runny nose, itchy eyes, and congestion. These symptoms can definitely affect your quality of life if they're not treated properly. So let's take a look at some of the signs and symptoms that you should watch out for. So the most common symptom of seasonal allergies is sneezing. This is usually the first indication that your allergies are acting up. It's because when the allergen enters your body will try to protect itself by triggering the release of histamine. Histamine causes blood vessels to widen and become leaky, which leads to swelling and inflammation of the tissues. That swelling can put pressure on your eustachian tubes, which connects the middle ear to the back of your throat, and when that pressure is released, it can cause a sudden jolt of air to be expelled through your nose and mouth, resulting in sneezing. Now keep in mind, this is just one theory as to why we sneeze when we have allergies. There's no definitive answer as to why we do it. But sneezing can be a good thing because it does help expel the allergens from your nasal passages. So, while it might be annoying to have these sneezing fits, it is your body's way of trying to protect itself. Another sign of seasonal allergies is a runny nose. This happens because when you're exposed to an allergen, your body releases histamine, which causes the blood vessels in your nose to dilate. The increased blood flow causes the small hairs and glands in your nose to produce mucus. This mucus is clear and thin, and it helps to wash away the allergen. Sometimes the mucus can become thick and discolored, especially if you're not able to get rid of it quickly enough. Stuffy nose or nasal congestion is another telltale sign that you might be dealing with seasonal allergies. Just like with a runny nose, nasal congestion occurs because of inflammation of the blood vessels in your nose. The swelling can block your nasal passages and make it difficult to breathe through your nose. This is where a nasal spray or saline rinse can come in handy. These can help reduce inflammation and get some relief. If your nasal congestion is really bad, you may even find yourself developing a sinus infection, which is when bacteria infects the tissue that lines your sinuses. You may notice that you have a fever, facial pain, tenderness, pressure, and you may even develop a cough. Last, but certainly not least, itchy eyes are another common symptom of seasonal allergies. This is because the allergen can irritate the nerves around your eyes. Your body then releases histamine, which causes inflammation. This results in itchiness, redness, and a burning sensation in your eyes. If you're experiencing this, you can use a cold compress with something like a cold wash rag to help reduce the inflammation. If you have 2 or more of these symptoms, there's a good chance that you're dealing with seasonal allergies. The best way to confirm this is to see your doctor. They'll ask you about your symptoms and medical history and do a physical exam. They may also perform allergy testing to determine what you're allergic to. Now, if your symptoms are really bad, they may refer you to an ENT specialist, who will examine your ears, nose, and throat to look for any signs of infection or inflammation. Now that we know some of the signs and symptoms, let's talk about the causes. Seasonal allergies occur when your immune system reacts to an allergen such as pollen, mold, or dust. Normally, your immune system protects you from harmful things like bacteria and viruses. But if you have seasonal allergies, your immune system will overreact to a harmless substance like pollen and cause inflammation. This can happen when you inhale the allergen, touch it, or even eat it. The most common type of seasonal allergies are hay fever and perennial allergic rhinitis. Hay fever is a reaction to pollen from trees, grass, or weeds, while perennial allergic rhinitis is a reaction to mold or dust. Let's talk about some of the most common triggers. The first trigger is pollen. Pollen is a fine, powdery substance that is produced by plants for sexual reproduction. It's carried by wind or insects to the plant's female part called the stigma. When pollen lands on a stigma, it can produce a new plant. However, pollen can also trigger seasonal allergies. The type of pollen that causes allergies is called aeroallergens. These are small and lightweight enough to be carried by wind, which means they can travel long distances and reach areas far away from where they were produced. According to the American Academy of Allergy, Asthma, and Immunology, the highest pollen counts are usually between 10 a.m. and 3 p.m. when the sun is shining and the temperature is warm. Pollen counts are also higher during windy days. That being said, the specific times of year when pollen is most prevalent will vary depending on where you live and the type of tree and plant life in your area. For example, in the spring, tree pollen is the most common trigger. In the summer, grass pollen takes the lead, and in the fall, weed pollen becomes the main culprit. That's why it's important to check the pollen forecast in your area so that you can plan accordingly. Another common trigger is mold. Mold is a type of fungus that grows in damp, humid environments. It can grow both indoors and outdoors. While mold can be a trigger year-round, it tends to be more prevalent in the fall. This is because during the fall, there's often a lot of moisture in the air due to the rainy season. Mold spores are released into the air and can trigger seasonal allergies. Now, if you live in a humid climate, you may experience mold-related allergies during the summer as well. So, now that you know what triggers seasonal allergies, let's talk about some ways to find relief. One of the best ways to reduce your exposure to pollen is to stay indoors during peak pollen times. You can check the local pollen count in your area and plan your activities accordingly. Keep windows closed and use air conditioning to keep pollen out of your house. Another option is to use over-the-counter antihistamines. Antihistamines are medications that block the action of histamine, which is a chemical that causes inflammation during an allergic reaction. Some examples of antihistamines include loratadine, cetirizine, fexofenadine, diphenhydramine, hydroxyzine, cetirizine, ranitidine, cimetidine, and telfast. You can find more information about these medications below. Nasal corticosteroids are another option for finding relief. Nasal corticosteroids are medications that reduce inflammation of the nasal passages. They come in the form of a spray and are applied directly to the nose. Some examples of nasal corticosteroids include mometasone, fluticasone, and cyclosonide. Again, you can find more information about these medications below. You can also try using a saline nasal spray or saline sinus rinse. A saline solution is simply salt water. Using a saline solution can help moisten and thin the mucus in your nasal passages. This can help flush out allergens and irritants. It can also help reduce inflammation. All of these options can be very helpful in managing your seasonal allergies. However, if you're still struggling, you can always talk to your doctor about allergy testing. With allergy testing, you can identify exactly what you're allergic to. This can help you take steps to avoid those triggers. Your doctor may also recommend immunotherapy, also called allergy shots. Immunotherapy is a treatment that helps you build immunity to a specific allergen. By exposing you to small amounts of the allergen over time, immunotherapy can help reduce your sensitivity to the allergen. Living with seasonal allergies can be frustrating, but there is hope. By working with your doctor, you can find ways to manage your symptoms and find relief. Thank you so much for watching. Please let us know if you found this video helpful. If you haven't already, please consider subscribing. We wish you all the best in your health journey.